Good evening, everybody. My name is Sean Doherty. I'm the New England chapter president for JDRF here in Boston, and we honestly are thrilled to have such a great turnout, and it's a testament to what's going on in the field of type 1 diabetes research. I think it's pretty easy to say that the last 12 months have been the most important, the most exciting, and the most impactful 12 months in the whole time that JDRF has been in existence since the early 70s. We are on the precipice of something very, very important, and I know that's why all of you are here, of course, also to see Dr. Melton, who has been a very large part of that this year. So on behalf of all of us involved with JDRF here in New England, thanks so much for coming to this, and we have several people from around the country that have joined us. So as I said, my name's Sean Doherty. My son Finn, like I'm sure every one of you in the room has some connection to this. My son Finn was diagnosed on October 31st of 2002, just shortly after his second birthday. We all remember our date. Didn't have anything to do with Halloween. It was in the morning. But we all remember everything about the day, and life goes on, and he's doing really, really well. But he now at 14 years old is paying attention. He's paying attention to everything that we're all doing here together to cure this disease. And so, without further ado, I want to turn you over to a really terrific all-star lineup tonight that's going to talk to you about the great advances in research, but also really importantly, JDRF's role in pulling that all of that together so that we can finally cure this disease, because that is all of our goal. We would like to put ourselves out of business and turn type 1 into type none. And so tonight we have with us John Brady, who's our international chairman. You're going to notice some commonality across the three gentlemen I'm going to introduce, because every one of them has a child with this disease too, and so therefore it's as committed to it as every one of you. John's been deeply involved with JDRF for about the last 15 years in some really interesting ways that he can talk to you about, and his son was diagnosed at 3 years old and is now thriving at the age of 25, but still living with this disease. I know you're all here tonight to see Dr. Melton, who's the father of 2 children with this disease. He is the co-chair of the Harvard Stem Cell Institute, among many other titles that you'll hear in a moment. And he's responsible, as you all know, for one of the most important advances in type 1 diabetes research since the discovery of insulin many years ago. It has such high potential, and it's so important for all of us, and we're very, very grateful for all the work that he's done. And then finally, and I will turn it over to Derek Rapp, who's the CEO of JDRF International, and has really hit the ground running since he started last July. We're very pleased for all the work that he's doing. He too came out of a volunteer role out of St. Louis, where his wife is still a very active volunteer, and their son, who's now 21, has been living with type 1 diabetes for some time. And the challenge that Derek has with John is, how do we pull all of us together, all these researchers together, all the volunteers, all the staff, to make sure that we're funneling as many dollars as we can to the right researchers in a connected way, and that's what we're going to try to talk to you about tonight. And so without further ado, I'd like to turn it over to Derek, and thanks again so much for your interest in this cause.
Good evening, everyone, and thank you very much. I'm not sure what's best here. I'm going to do that. You can hear me just fine, I think, right? Great. What a fantastic turnout. Thank you all. In fact, if you don't mind, I'm going to come down here so I'm more in the middle, if that's okay. So as Sean mentioned, yes, I'm one of the fathers in the lineup who has a close connection to type 1 diabetes. And like Sean and like all of you, probably our date is etched in my brain too. It's November 15th, 2004. And at that point, our son Turner was 10. And he joined his great aunt and great uncle and 2 first cousins who had type 1 diabetes. And a couple months after that, a second cousin joined them also. So we have, of course, a strong family connection to this disease. I was at the time CEO of a biotech research company in St. Louis, and I was encouraged to, and happily, to join as a research volunteer for JDRF at that point, and became increasingly involved in the organization. And was always convinced right from the start that we were going to see significant progress eventually, and we would have to be more patient than any of us would want to be, but that we would see significant progress happen eventually in this area. And that when it did happen, that there was a very good chance that the learnings that were being generated through the work that JDRF was doing would have a significant hand in the ultimate success that we see. I was also, of course, moved by the mission of the organization to cure and prevent this disease, and until those fantastic days come that we do, to make living with this disease easier for the people who have it and also for their families. As we know, this is a disease that one person gets, but the entire family, of course, is so touched by it. And so we all experience it together. And so even some of the products that are about helping improve flow of information. I was just with someone who was watching her child in Italy and seeing how his blood sugar is doing while she's here at this event tonight. So it obviously, the technology improves in so many ways and helps us all. The expression turning type 1 into type none was one that came much later, but it sure works for me. And if you're going to hear a lot of exciting things tonight about science, and probably many of you have been reading about exciting things for a while. And so you should know that I am absolutely convinced that the day will come that we will cure and prevent this disease. And so I'm moved by that mission and excited by the possibilities that I see. And as Sean mentioned, it has been a fantastic year for science. And so we want to make sure you understand that. But JDRF is not only about science, it's about really making a difference in people's lives. And so we are also committed to seeing products reach the marketplace. And that means that the companies have to invest in them and believe that there is a real opportunity to make a profit. And yes, that is an element of this, of course. And then we need the FDA, the regulators here and around the world to say, okay, this is, in fact, a product that is safe and effective. And then we need the reimbursers, whether that's Medicare and Medicaid, or whether that is the big healthcare payers, around the country, to continue to reimburse products, which means that they have to understand that there's a value proposition for them. And finally, we need healthcare providers to say, you know what, patients do better, people do better when they are on these therapies. And so those are all activities that JDRF is committed to as well. And so that's the complement to the research funding that you'll hear about this evening. As you hear about some of the specific activities, and obviously tonight we're going to focus a lot on encapsulation and on the cells that can make a real difference. Understand that those activities are part of a consortium. And in fact, there are several consortia that we have in different areas. In addition to encapsulation, we also have them for artificial pancreas and for beta cell health and others, and prevention. And it's important for you to understand that, because part of what I think JDRF really brings that's so impactful is this global understanding of that is not only the disease itself, the biology, et cetera, but also of who around the world is conducting research in the different areas. We work to try to put together scientists, or help them come together to do their best work, to learn from each other, to try to avoid some of the challenges that have been experienced by other scientists along the way. And obviously, type 1 diabetes is a very complicated disease. And so for that team of 25 or so PhD scientists at JDRF to help connect the different scientists, both in academia and in companies, small and large, around the world, is a very important role that we play. JDRF will fund directly this year roughly $100 million in research. But in addition, our impact goes far larger than that because of the work that we do both with government bodies and then with other providers of funding who, in many cases, look to the work that we do as, in a way, due diligence. So I'll use sort of a financial way of looking at things. A JDRF comes in and does a lot of the due diligence, and then others say, okay, now this opportunity has been de-risked and understood better, and then others come in. And whether that is, again, a not-for-profit or even a company that says, now this is an opportunity that has shown a proof of principle, and so it's time for us to come in and turn this into a product. So that's an important role that JDRF plays, and one that we will continue to play. And so that's a part of the impact that we have as an organization for sure.